All right, today we're going to talk about must-knows in Medicare, and I picked Medicare Part D to be the topic for today. Um, so these are some things really high level that I think everybody needs to know about Medicare Part D. That's what we're going to be talking about. And of course, there's three things that I want you to get out of today's call. One, I want you to understand and know that there is variability in the coverage under Medicare Part D. Okay, so we're going to talk about that. Two, I want you to know about the cost considerations. I want you to be able to help your clients navigate the expenses of Medicare Part D. All right, so we're going to talk about the cost considerations for Part D. Then the third thing is we're going to talk about enrollment deadlines and how you can help your clients at a minimum understand those enrollment periods. All right. So for anyone who may be new and may be wondering, who is this chick that keeps talking? My name is Nicole Broadhurst. I'm a former healthcare administrator turned independent patient advocate, CEO of Tennessee Health Advocates, and founder of The Circle, where I help independent patient advocates create sustainable and profitable practices without the chaos of entrepreneurship. So you may wonder, why did I start The Circle? What is this all about? So I started my practice in 2019. And literally by the end of 2020, I was ready to quit. It was too much. It was just too much work, too many things happening. And you know what? I wasn't even making any money. And that was a problem in my life. I needed to make some money. So in late 2020, I met Jason Elkins. I went through his 100 Cup Academy. And what I learned there was freaking amazing. It set me on a trajectory to double my revenue year after year, and it hasn't stopped yet. So this year is not going to be any exception. So what did I learn in that system? I learned that I needed a community that would help me grow my business, increase awareness of my profession, and maintain alignment with who I am and why I became an advocate in the first place. So if any of that resonates with you, you are in the right place. So today we're going to talk about Medicare Part D. Let me get back over to my notes because without notes, it will just be a jumbled up mess. Okay, so first things we want to talk about in regards to Medicare Part D is we want to talk about the coverage variability and how it can change. One of the things that I want to share with you guys is this link to the CMS website, because you guys don't know I'm all about the resources, right? So that is CMS's main page on Medicare Part D. So if you have questions, I want you to bookmark that page because all the answers that you could possibly need, things that we're not even going to talk about today, you can find on that site in that website. Okay. So that's your go-to resource. It's important for us to understand that Medicare plans can really vary in their formularies and the costs associated with the medications. So the goal of this section of the call is to help make sure you have what you need to educate your clients on how to review these plan formularies and how to review these plans to make sure that they're getting the coverage that they need when they need it. So the first thing I want to share with you is that make sure that your clients know that they can evaluate this each year and they can change their coverage. They can change plans each year. Okay, so the one that works this year, next year, we may have different medications. We may have different financial situations. We may have a different circumstance, right? So it's really important. It's really important that our clients know that this is a piece that it is safe to evaluate and make potential changes annually. And the reason that I share it very slowly like that is because my mom, I try so hard, my mom said to me, during annual enrollment, I said, Mom, did you look at your Part D? How are we doing on that? Is everything okay? And she said, No, I didn't look at it. You tell me never to look at any of those and that I'm not supposed to change anything. And that's because they have traditional Medicare with the Plan F, right, which is no longer available. And so it's not a financial thing. So I never want them to change to an Advantage plan or anything like that. They're both cancer survivors. They have exactly what they need. So anyway, I had to walk my mom through this and let her know that Part D, that's safe. The medication plan is safe for her to evaluate each year. So that will be helpful. I'm going to drop a link in the chat to the plan finder. Okay. And that's where you can go. There's a couple of things. You can go there, your clients can go there. This is the official CMS website that will tell you all of the plan, not just the Plan Ds, but that's what we're talking about today. You can pull up by zip code all of the options for your clients. They can pull them up. You can start looking at them and really getting a good idea. So again, the second link that I'm providing as a resource is the actual plan finder for Medicare. I have found it super helpful in comparing those plans. You can also make sure that's where you can go. You can look at the plans. And then here's the actionable steps that you can even take it a step further to help your clients. You can actually, and this may be something that you want to offer during open or annual enrollment each year, right? A service where you do a comprehensive medication review with your client, get a consistent, concise list of medications, and then help them, or maybe you compile the options in their area so that they can look at it side by side and help them explore their options to make sure that they have what they need. In fact, somebody like me, I would not do a medication review. However, if I were offering this service, I might contract with my buddy Nancy, who's a pharmacist, to do that piece of it, right? And do the medication review, and then take the information from that official medication review and use it in the comparison plan. So that's something you can think about too. And in case you're wondering, we also have subcontracting on the calendar too. So that if that's something that you have on your mind, well, what would that look like? How would I just contract out a single piece of this service? Make sure you come to that when we'll talk more about that particular thing. I mentioned that because anytime we get outside of our scope, it's important for us to pull in the resources that we need. And collaborating is a great way to do that. So you might do a comprehensive medication review, make sure you got their medications, their dosages, and then compare that to the formularies, because the formularies can change, and they do. So you want to make sure that you're covering those. The other thing that I want you to know about the variability of coverage is prior authorizations and exception processes. Okay, so these can be different based on the plan. And so it's important to know what are the exception processes or policies, and what are the prior authorization policies and processes for your client's particular Part D plan. So this is something that I do on the front end with every client that I have. I have an entire intake questionnaire about their insurance, so that I make sure that I get copies of their cards, I get access to their portal, I get, a summary plan description, right? A formulary, like I get all of that documentation up front. In fact, I just did an onboarding for a new client, and that package alone, it was funny, was 425 pages when I got it all pulled together. The first 10 pages are all she really needed. Like that was the information she was interested in. But I always make sure that I pull and provide all of the supporting documentation. And I think I shared with you before that I had a client had a hearing aid. She tried to get a hearing aid and they told her it wasn't covered because it was out of network. But when we had gone through her benefits, it indicated she had a 50% co-insurance for out of network hearing aids. And so when we went back through the documentation I put together during the onboarding process, that's date stamped from the insurance carrier's website that has the information. So it's really important to make sure that we're documenting the information that we get and having that available. So make sure that you're looking at those policies. And if not, That's a great up if you don't want to, right? Because that's a lot. Like reading a plan summary description is, I don't know. I read the Federal Register, so I think it's fun, but I know that there's lots of folks that don't. So if that's not something that you're interested in doing, maybe get with another advocate who likes doing this and will do the review for you and get you a report that you trust, right? And includes it in your, can you guys hear the dogs? No? Okay, well, that's good. All right, so think about that might be another opportunity to collaborate with another advocate in regards to that. But the important part is that you know that prior authorization and exceptions to formularies are possible with Medicare Part D plans. Okay, he's bugging me. I'm going to let him go. There we go. All right. Okay, so let's see, where else are we? All right, so we talked about the variability of coverage. We talked about the plan finder. We talked about medication review. We talked about prior authorizations and the exceptions processes. Okay, so the second topic that we want to talk about are the cost considerations. There are costs associated with Medicare Part D, right? So when we pull those options, the things we want to be helping our client understand are the cost of premiums, the cost of deductibles. You know, you can generally go through and be able to anticipate the medication expenses, because once you've done the medication review and you have that comprehensive list of medications, you can take that list of medications and look at the formulary and find out what tier they're on and what cost sharing responsibilities there will be with that, and really get a pretty decent estimate of the expense that it's going to cost them to be on those medications for the year. Okay, so you can actually, like I said, it's not that hard and challenging. You can do that in that plan finder and find all that information. Okay, so that'll help you walk your clients through that comparison and help make sure that they're getting the best financial assistance available under the policy. Also help you do a return on investment. Like, does it make sense to spend this money on this premium for this level of coverage, right? Okay. The other thing that you can do to help with the cost considerations is you can help your clients investigate extra help programs, because there are extra help. Like there's the low income subsidy that can help with the Part D premiums, deductibles, and co-payments. There's opportunities to help them get dual eligible, where they can have Medicare and then Medicaid is their secondary. That also helps pay some of those out-of-pocket things. So you can help educate your clients on the availability of those programs and help them better understand that. The third thing that I would suggest you do with these cost considerations is help them understand the coverage gap, right? Because Part D does have a coverage gap. Most commonly it's talked about, they refer to it, lots of times you'll hear it referred to as the donut hole. However, for 2024, I believe, and you can get this information on the CMS website, but I believe that it's between $5,000 of expenses, medication costs, and I think you come out of it at $8,000. Okay, and so there's percentages in between there. We're not going to get into the specifics, because I think that the most important thing for you to know is help them understand that that there is this gap and what that looks like for them. And then again, for more specifics, go to that Part D website at CMS. All of the information is there. All right. Awesome. All right. And then of course, you can also help them explore strategies to mitigate the gap cost. And I know Myra's got some specific experience on this. Like there are strategies, and we can get to that a little bit later, but there are strategies on when you understand the coverage gap, there are strategies to use that you can perhaps for your maintenance medications. Maybe it makes sense to pay cash for those under a discount program like GoodRx or Single Care or Cost Drug Plus, or any of those other. I use Amazon uh, for a lot of reasons, but I use Amazon, and a lot of times I'll do the cash price on Amazon. So sometimes that makes sense to make sure that you stay underneath that threshold of the coverage gap. Other times it makes sense that if you're on really expensive medications, sometimes it makes sense first thing in the year to go ahead and get it out of the way, right? And just hit it and get in and out of it. But that's going to be really specific to the patient, to the client, to their financial situation. Like, there's no way to know what strategy is best until you start looking at it, because it's very, very personalized. For my husband and I, we very rarely use our medication coverage because we have the same deductible and out of pocket on it as we do all of our other services, and it's crazy high. And we're probably, I mean, something really, really bad would have to happen for us to hit it. So we pretty much almost always pay out of pocket with one of the discount programs. Just something to consider. Okay. And then last but not least, the third thing that I want to make sure that we talk a little bit about, and we've talked about this before, to help your clients. And we've talked about upselling and how to make yourself more valuable to your clients. And I just want to mention that this topic is a way for you to do that. Okay. It is making sure they understand enrollment deadlines. Okay. So on your calendar, if you don't already, I'm going to suggest you consider setting reminders on your calendar for all of the enrollment periods for Medicare. So you can't do the initial, but the annual enrollment period, the special enrollment period, the one that runs from January to March. I can't think of all the names, but again, you can get these on the CMS website and put reminders on your calendar for these particular enrollment periods. And here's why I say this. Keep it front of mind for you. Here's what I can tell you. Between January 1st and March 31st, I actually did a tracking. And do you know how many people I talked to in that period of time? This is crazy, who didn't have Medicare Part B and needed it? There were five. There were five people that I randomly talked to, differing, like all kinds of different situations and reasonings, but five different people that I talked to that didn't have Part B, that needed it. And it just so happened we were in that benefit, that enrollment period, that I was like, look, you need to do this. Like, only one of them was in a penalty period. The others were okay and safe. But my point being is they didn't even know. Right? They didn't even know that that was an option for them. And oh, by the way, you can do it right now and you'll get it done. If you don't do it before March 31st, you're going to have to wait until next January. Okay. So you having it on your calendar will help it be front of mind for you, so that when that happens, you can be like, oh, wait, I need to tell you about this. This is really important. The other thing is, make sure that you know all of those qualifying life events. If you're not familiar with what a qualifying life event is that will trigger a special enrollment period, I'm going to encourage you to go to that website on CMS, make a list, tape it on your wall. So that when you're talking to people and they say things like, oh, I just lost my job, I don't have my insurance, blah, 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 you immediately know, oh, that's okay. We have a special enrollment period for qualifying life events, and you just had one. So let's get you enrolled in Part D or whatever it is. This is that extends beyond Part D, but we're talking about Part D, and you do have special enrollment periods with qualifying life events with Medicare as well. Okay. In fact, with Medicare, if you're on an Advantage plan and you move to a different zip code, that can even open up a special enrollment period. Okay, because the plans that are available are very, very localized. All right, so be aware of those. And again, these are all value add things that you can bring to your client and not have to know like everything about Medicare, right? These are just big overarching things that you can know and bring value and help your clients. And if it gets into the nitty gritty, then don't be afraid to reach out, right? And get some help from somebody who knows a little bit more about the details. All right. I feel like I just like ran through that. I don't know why, probably because the dogs are barking and it's making me a little bit anxious. But that's really, those are the three things, and those are the things that I wanted to make sure that you got out of today's session about Medicare Part D.